You will not want to wear regular underwear while you're healing, so it depends, or some type of disposable underwear is going to be very helpful for you. So I pretty much wore these, or went without underwear on occasions, because um, you just want to be as free as possible. You don't want to mess up your nice underwear with blood and lymph drainage and stuff like that. So these came through Clutch. um, a neck pillow can also be helpful. Even though I was in a recliner, sometimes my head would droop, so having a neck pillow to keep me steady so I didn't have crooks in my neck was very helpful. Or if you decide to sleep sitting up in the bed propped up with pillows, this will be very helpful as well to avoid any neck issues. um, Hibiclens is also very helpful. This is a antimicrobial, antiseptic soap, or skin cleanser that most surgeons will ask you to start using about 5 days prior, as well as the night before surgery and the morning of surgery, to prep your skin. Having a couple loose garments is also helpful, because you want to be as free as possible, so you don't want any restricting clothing. So I had actually a few different pair. Also having a robe was very helpful, especially the day of surgery. You don't want to wear anything underneath, so something loose that the nurses can get you in after surgery, and also for you to wear after surgery, is very helpful, so you don't have anything rubbing against your skin, and you want to be as free as possible. Arnicare Tablet is also helpful to help with pain and stiffness, as well as bruising and swelling. So two of these every, I think, 6 hours under your tongue. They dissolve quickly, so that was helpful. Um, Cough drops was very helpful. I thankfully didn't have to use them, but I had them on deck just in case I had a cough coming on. You don't want to, disturb your muscle repair, or put yourself in pain by coughing or sneezing. So this is going to be very helpful. I just drank water if I felt a tickle in my throat, or if I could kind of brace myself with a pillow. That was helpful. Having some shout wipes was also helpful. So if you had any stains on your clothes, you could easily get them out. Um, Having several different seamless tank tops was also helpful to wear under my binder, so I can have some a barrier between my skin and the binder, so I wouldn't have any friction happening. So this was nice. uh, Hydrogen peroxide, of course. It helps with getting out blood stains and things like that, and cleaning wounds if you need it. Lymphatic droplets, these are my best friend, to help with lymph drainage, along with drinking water and drinking pineapple juice, as well as eating fresh pineapples. That definitely all together helps with lymph drainage. Then I have my drain bags. So I have a mesh one for a shower, and then two little drain bags. So if I was out and about and I didn't want, my drains to just be out showing, I could easily conceal them each in this. So you just tie it around your waist, or clip it around your waist, and then your drains are not visible really. So, and then you want some gauze in case you need to put them around your incisions. um, this is helpful also, just to make sure that the area incision is protected and not rubbing against fabric and stuff like that, 'cause that would hurt. And then I had an extra an extra binder, even though I didn't use it. This one happened to be too small and wasn't stretchy enough, so maybe once some of the swelling goes down, I'll be able to use this one if I use it at all. You want some chuck pads. So these are like the surgical pads that you will put down under you for any lymph drainage and blood drainage. I only had to use these the first day or two, so I bought too many. I bought like a 50 pack and I only probably used like 10. So don't buy too many. Someone that has like a BBL or lipo might need more of these than someone that has a tummy tuck. And then flushable wipes were definitely helpful as well, so that like, you know, in a bind, you can wipe, or if you're sensitive, you can wipe. This is also what I use to clean myself when I wasn't able to take a shower, because after surgery, you're not able to take a shower for about 24 to 48 hours, depending on the doctor. So I wasn't able to shower for 2 days, so these came in clutch as well. Also, Arnicare gel. So using the tablets along with the gel was very helpful with helping my bruising and swelling go down. Now you will be swollen for a while, but this is very helpful when paired together to help your pain and soreness diminish quickly, as well as bruising and swelling. Also having some medical tape as well, in case your incision tape starts to lift, or your surgical tape starts to lift, or you need to like tie down the gauze or something. These will come in clutch as well. And then I had extra pairs of compression socks. These are 20 to 30 mmHg. I bought some before and they felt like socks, like they weren't compressing at all. These definitely compress and are good. So I will put a link of everything in the description where I got them off of Amazon. These are the things that I felt were most helpful. So you don't want to go buying $500, $600, $700 worth of things. I bought a little bit more, but I just wanted to show you things that I actually used, so that you don't go spending a lot like I did. I didn't spend like $600, but a couple hundred, and I didn't really need to spend even that much. So this is what I found useful, and I hope you find it useful as well. What's not shown here is an extra compression bra. So I bought an extra one. I have it on right now, so that I could have something to interchange with the one that I got from my surgery center. So if you have any questions, let me know, and I hope this was helpful.